The topic of the tutorial is parotid gland, and I, Dr. Alpana Kesar, will be covering this topic under the following subheads: location, size and coverings, borders and surfaces, relations of the parotid gland, secretomotor nerve supply of the gland, parotid duct, and applied anatomy. The three main salivary glands are parotid, submandibular, and sublingual salivary glands. Out of this, parotid is the largest. It is irregular in shape, yellowish in color, and it is a lobulated mass. It is present below and in front of the external acoustic meatus. A part of it is wedged between the ramus of the mandible and sternocleidomastoid muscle, and its anterior part projects over masseter muscle. It is shaped like an inverted pyramid with the apex pointing downwards and the base facing upwards. Coverings of the parotid gland. The covering of the parotid gland is called its capsule. The capsule of the parotid gland is derived from investing layer of deep cervical fascia, and this makes the parotid capsule unyielding. So whenever there is any inflammation of the parotid gland due to its unyielding nature of parotid fascia, there will be exquisite pain in front of the temporomandibular joint. This is caused by stretching of the capsule, which will lead to stimulation of great auricular nerve, which is a sensory nerve in the region of parotid. The pain is usually exacerbated at the time of meals when the gustatory stimulus to the gland will produce further turgor within the capsule. This is most commonly seen in patients suffering from mumps or parotid duct obstructions. Borders and surfaces of parotid gland. Parotid gland is shaped like an inverted pyramid. It is a three-sided pyramid. Since it is inverted, its apex is pointing downwards and its base, also known as its superior surface, is facing upwards. It has three borders. This is the anterior border. This is the anterior border of the pyramid. This is the posterior border of parotid gland. And the third border is its medial border. This is its medial border. Its three surfaces are the superficial surface or the lateral surface, the anteromedial surface, and the posteromedial surface. So, parotid gland has three borders and three surfaces. It has an apex and a base. Structures related to borders and surfaces. Apex, which is pointing downwards, is related to the posterior belly of digastric. External carotid artery enters the parotid gland at its apex. Cervical branch of facial nerve comes out of the parotid gland at the apex, and the two subdivisions of the retromandibular vein exit the parotid gland at its apex. The base or the superior surface is related to external acoustic meatus, temporomandibular joint, superficial temporal artery, and auriculotemporal nerve. This is the superficial surface of parotid gland. The superficial surface of parotid gland is related to skin, superficial fascia, and parotid fascia. It is also related to preauricular or superficial parotid lymph nodes and great auricular nerve, which is a sensory nerve that innervates the skin over the parotid region. The anteromedial surface. The anteromedial surface is related to the posterior border of the ramus of the mandible, masseter muscle, and medial pterygoid muscle. The posteromedial surface. The posteromedial surface is related to the mastoid process with the attachments of sternocleidomastoid and posterior belly of digastric on the mastoid process and styloid process with the structures attached to the styloid process. Anterior border of parotid. Three structures exit the anterior border of parotid. They are the parotid duct, the terminal branches of facial nerve, and transverse facial artery. Posterior border overlaps the sternocleidomastoid muscle. The medial border is related to the lateral wall of pharynx. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Relations of the structure passing through the parotid gland. These are all clinically important relations of the parotid gland. Three structures which pass through the parotid gland and is intimately related to the structure of the gland are facial nerve, external carotid artery and the branches that it gives within the parotid gland, retromandibular vein and its tributaries. Facial nerve. Facial nerve, after coming out of the skull through the stylomastoid foramen, enters the parotid gland at its posterior border. Within the parotid gland, the facial nerve divides into its 5 terminal branches, that is temporal, zygomatic, buccal, marginal mandibular and cervical. All the 5 branches of the facial nerve emerge from the gland at its anterior border. After emerging from the parotid gland, these 5 terminal branches of the facial nerve will supply the muscles of the face. The intimate relations between the facial nerve and the parotid gland makes the surgeries of parotid a challenging surgical operation. Malignant tumors of parotid gland may require surgical removal of the parotid gland, which is a difficult dissection as care must be taken not to damage facial nerve or any of its branches. If facial nerve or any of its branches gets damaged, it will result in paralysis of the muscles of the face. The second structure traversing through the parotid gland is the external carotid artery. The external carotid artery enters the parotid gland at its apex. It then continues in the upward direction. It gives three branches within the parotid gland, and they are the posterior auricular, the maxillary, and the superficial temporal. Hence, external carotid artery with its three branches are present in the parotid gland. And again, during the parotid surgeries, care must be taken not to damage these branches or the external carotid artery. The third structure that passes through the parotid gland is the retromandibular vein and its tributaries. The retromandibular vein is formed by the joining of superficial temporal vein with the maxillary vein, formed within the substance of parotid gland. The retromandibular vein has a short course and then it divides into its anterior and posterior tributaries. These pass inferiorly and exit the parotid gland at its apex. Care must be taken not to damage any of the structures passing through the parotid gland, namely facial nerve, external carotid artery, and retromandibular vein during the parotid surgeries. Blood supply of parotid gland. Blood supply of parotid gland is by the external carotid artery and its branches that traverses through the parotid gland. Venous drainage is into external jugular vein. Lymphatic drainage is into parotid group of lymph nodes which overlie the parotid gland, which then drain into the upper deep cervical group of lymph nodes. Innervation of the parotid gland. Sensory innervation of the parotid gland is by the auriculotemporal nerve, which is a branch of posterior trunk of mandibular nerve. The secretomotor or the parasympathetic pathway to the parotid gland begins in the inferior salivatory nucleus in the pons. The preganglionic fibers arising from pons pass into the glossopharyngeal nerve, then into its tympanic branch and tympanic plexus. The fibers then pass into the lesser petrosal nerve and to the otic ganglion. The preganglionic fibers will relay into otic ganglion. Postganglionic fibers arising from the otic ganglion will pass into the auriculotemporal nerve to get distributed to the parotid gland and thus control the secretions of the parotid gland. Parotid duct, also known as Stenson's duct. Parotid duct is 5 cm long, which emerges from the parotid gland at its anterior border. It runs forwards over the masseter muscle to reach buccinator. It pierces buccinator muscle to open in the vestibule of the mouth opposite the crown of the upper second molar tooth. Clinical anatomy of parotid gland. Parotid swellings are very painful due to the unyielding nature of parotid fascia. Mumps is a viral infection of parotid gland. Infections from the oral cavity can spread to the parotid gland through the parotid duct. Facial nerve must be preserved during the parotid gland excision, which may be required in case of malignant tumors of parotid gland. Malignant tumors of parotid gland may involve the facial nerve. Hilton's method for parotid gland abscess drainage. It is a surgical technique which is used to drain abscess in the region of the parotid gland. It involves making a small incision in the most dependent part of the abscess. After that, sinus forceps are inserted, which are then used to break the loculations or pockets of pus within the abscess. The incision is slightly widened with the help of the sinus forceps, and then the abscess is allowed to drain. This helps to minimize the damage to the surrounding structures, especially the nerves and the blood vessels. Freiss syndrome is also known as gustatory sweating. It is associated with redness and sweating in the skin over the parotid gland at the thought, smell, and sight of food and at the time of eating. This usually occurs following traumatic injuries in the region of parotid gland. Post-traumatic injury, when the healing occurs, intermingling of the fibers of auriculotemporal nerve may occur with the great auricular nerve. Auriculotemporal nerve is secretomotor to the parotid gland, and the great auricular nerve supplies the skin of the parotid region. It also supplies the sweat gland in the region of parotid gland. So when the intermingling of the fiber occurs, then at the time of eating, the auriculotemporal nerve gets stimulated to stimulate the parotid gland. At the same time, the great auricular nerve may also get stimulated, thus leading to sweating in the region of parotid gland. Some of the questions that may be asked from the topic parotid in the examinations include a long question: describe parotid under the following heads: location, coverings, relations, and the secretomotor pathway of parotid gland. Secretomotor pathway of the parotid gland may be asked separately as a short note. Some of the other short notes that may be asked are: draw a well-labeled diagram showing relations of parotid gland, describe the structures passing through the parotid gland, a short note on the parotid duct, Freiss syndrome, why are parotid swellings very painful. Please note that whenever the relations of the parotid are asked, it must be described under two subheads. 1. The relations of the borders and surfaces. 2. Relations of the parotid with the structures passing through the parotid gland, which includes the facial nerve, external carotid artery, and the retromandibular vein.